Parkinson's is the fastest growing neurological condition in the world, and there is currently no cure. However, spotting the signs early and seeing your doctor as soon as you suspect Parkinson's can help you to access treatment and manage the condition. But do you know the unusual symptoms of Parkinson's to look out for? What is Parkinson's? Parkinson's is a type of condition known as a neurodegenerative disease. This means it affects your brain, and that the parts of your brain affected by Parkinson's become worse over time. It is possible for Parkinson's to affect your brain for a long time before you experience any symptoms, and the symptoms of Parkinson's are different for everyone. Parkinson's symptoms develop because the brain stops being able to make the dopamine it needs to control movement properly. The most well-known symptom of Parkinson's is developing a tremor, as this is perhaps the most obvious. However, there is a heap of lesser-known, unusual, symptoms that can go unnoticed. These are known as invisible symptoms, and they include one affecting your weeing habits. What is the sign of Parkinson's in your wee? Studies suggest between 30 and 40% of people with Parkinson's experience difficulty with urinating. Problems with your pee can present in a number of different ways. Some find themselves weeing more frequently, whereas others find they have a weaker stream when passing urine. A telltale sign is waking up often in the night bursting for a wee, or finding yourself going to the toilet often. Around 15% of people with Parkinson's may experience urinary incontinence, but this doesn't tend to happen until the later stages of Parkinson's. So, why does Parkinson's affect your pee? As Parkinson's affects your brain, it can cause problems with both your motor skills and your autonomic nervous system. The autonomic nervous system is all of the mostly unconscious movements your body takes care of, like blood pressure, sexual functions, and your urinary tract. Your bladder has two main jobs: holding onto your wee, and getting rid of your wee. Parkinson's can affect the bladder's ability to perform both of those functions, which is why it can cause you to wee more, or wee less. It's basically a sign your brain and bladder are struggling to communicate with each other. When should you see a doctor about Parkinson's? As with many conditions, an early diagnosis of Parkinson's could make all the difference to your treatment. If you suspect you might have symptoms of Parkinson's, see your doctor straight away. Don't forget, not everyone gets every one of the symptoms, and they can be different for everyone who has Parkinson's. It's still worth getting checked out if you are concerned. There is no cure for Parkinson's, but a diagnosis can help you to access treatment, including physiotherapy and medication. Other invisible symptoms of Parkinson's include constipation, low blood pressure, sexual problems, erectile dysfunction for men, reduced libido for women, excessive sweating, loss of taste and smell. While these are the more unusual symptoms of Parkinson's, the three most common symptoms of Parkinson's are developing a tremor. This usually begins in the hand or the arm. Slow movement. This can present in a slow and shuffling walk, as physical movements become slower and more difficult. Muscle stiffness. This can make movement and even facial expressions difficult, and cause painful cramps.